and welcome to the Time2Shine talk show. This is your host Ruxar Sayed, and today I'm in conversation with Puja Patel. And in today's special episode, we are going to talk about her journey of being a diabetic educator. Welcome, Puja, on my show, and I'm so happy to connect with you today on this platform.
Thank you. Likewise. Likewise, very nice to connect.
So, Puja, I'm very excited to know that how have you started your journey in this unique, area, like, being a diabetic educator? What came into your mind and what sparked your interest in this field? Can you, elaborate a little bit more to our audiences?
Of course. So I'm my background actually, I'm a registered nurse. I'm a registered nurse from Canada. I've been nursing for about 15 years. And my specialty, my background, my nursing background is as a surgical background, but I
Hmm.
also within surgery, we do a lot of education with diabetic patients.
Hmm.
So I've always been interested in educating in diabetes, the epidemiology of diabetes. And and then just organically, I became a professor of nursing. So I that interest kind of sparked as an educator. So I kind of put both my passions together, and um, you know, I I love absolutely love engaging with clients who have diabetes, patients who have diabetes, and helping them just get healthier overall, not just their diabetes, but just overall too. Yeah, so
Exactly.
that's my background.
So, Pooja, how has your
Yeah.
experience of being a diabetic educator influenced your approach to teaching and healthcare innovation? How it has influenced that?
So in terms of innovation, what we do at Wellness Care. So Wellness Care is sorry, my virtual clinic that I see patients in. And what it is I use something called CGM, which is continuous blood sugar monitoring. And what that is this new technology and exciting technology that people with diabetes, they wear on their arm. You might have seen it also, or their bellies. And so what that basically does is it monitors their blood sugars continuously. And so as soon as there's a little bit of a dip or a little bit of a high in blood sugar, the monitor will beep on the phone, and it will send a signal to their own phone, and they'll send a signal to me
Wonderful.
as the healthcare provider. Yeah, as a healthcare provider. And I'm able to help them navigate through that situation. And so my approach, my philosophy for wellness care is it's a 3-month journey for the client, for the patient with diabetes and me, and basically just helping them get healthy, getting their blood sugars in control. And so I integrate technology and personalized plans, like personalized nutrition, personalized exercise, lifestyle modification like smoking cessation, for example, and stuff like that to create a personalized plan for patients with diabetes.
So, Pooja,
So
can you
that's,
share, a success story from your experience as being a diabetic educator? I know you
yeah. So
have many, but can you share one on our show? Yes.
all of the stories are stories, thankfully, even if there is a little bit of a change, even if there's a little
Yes.
bit of a change, I consider that a success story. But one that comes to mind particularly is this young gentleman, very young, early 30s, and he was diagnosed with pre-diabetes. And so that's not when you're actually diabetic. That's when you have your fasting blood sugar is a little bit high. Your 3-month overall average is a little bit high. So and you carry a lot of weight in the
Mm-hmm.
midsection. We can all kind of
Exactly.
relate to that, right? Your waist is a little bigger
Yes,
than
yes,
it
yes.
should be. Yeah. So I worked with him for 6 months, and he did amazing. His lifestyle's completely changed. His body mass index has come down significantly. He's a little bit overweight, and so
Okay.
his body mass index has come down significantly. His waist has decreased, size has decreased.
Mm-hmm.
He goes again, like his lifestyle has completely changed. His nutrition, he's exercising regularly still, and the best part is he is no longer pre-diabetic.
Yeah, so
That's
Puja, according to me also, it's like the lifestyle change which impacts more positively, if you in your in the, individual's diabetic journey, if they want to
yeah,
improve. So the first and the foremost thing is that we need to change our lifestyle. We need to, take look a more, have a more deeper insight into our dietary plans. What diet are we taking? And what nutrition we have to focus on, so that is the major part. Yes.
exactly. Yeah, for sure.
So
And people actually, sorry to interrupt, but
yes,
people
yes,
actually continue to that have that mentality that I'll take a little
yes,
bit of medication and my blood sugar will be okay.
yes, but
But
that's totally wrong.
make sure
That's
exactly, yeah, that's a it's a different, philosophy, different way of
that's
thinking.
a
But
shortcut, we
really,
can
like if
say. A shortcut. We are
yeah,
relying
it's
on
a short
medicines, and then we have to face the side effects as well. We have to face the negative side of those medicines as well.
exactly when really all you have to do is alter your diet, put in a little bit
Yes,
of exercise, just some
exactly.
lifestyle mod, and you're healthy. Like that's just how nature
For
intended us
many,
to
yes,
be,
and not
right?
only for diabetes, I must say for many other problems, like even in women we see major, like thyroid or PCOS, PCOD. What is the major, the most important solution in this is the lifestyle change. And what you have to do is you have to concentrate on what you're eating, what you're feeding your body. So that is the most important thing, not only in diabetes but also in other areas. We are seeing the major impact which is having on our health is our lifestyle, the kind of lifestyle we are living.
Exactly,
Yes. So,
exactly. Yeah.
Pooja, moving forward, as a nursing professor, how do you instill empathy and understanding in future healthcare professionals when it comes to caring for patients with diabetes?
Oh, that's a great question. So, I'm going to separate empathy from diabetic patients. So, empathy in general, I think,
Hmm.
is really like it's really important to understand how the patient is feeling, right?
Exactly.
To be able to relate to that. So, feeling empathy, I would take it a step further, and I would say critical thinking skills as a nurse, as a nurse is more important. And then the empathy kind of comes. So if you are able to think outside of the box, the empathy will come kind of automatically, and you will be able to relate better to your patient. So how we teach empathy as a professor of nursing, how I teach empathy is really I give them 1 week, just 1 week, and I tell them no sugar,
Hmm.
just no sugar at all, no added sugar. So even if you pick up a thing of yogurt, just flavored yogurt, there is close to 12 grams of sugar in that flavored yogurt. And usually, these students, when they come, they'll come with a granola bar or they'll come with that yogurt because it's quick. Right, it's quick. And so we go through that during the week and we say, okay, well, how many grams of sugar here? You can't eat this, right? So just being able to show them how much of a lifestyle modification that they have to make as healthy individuals. Imagine that impact on people who have a disease now, who have been diagnosed with something that is going to last them forever, that is multi-organ, that's going to affect all systems in their body. So
Exactly.
that's one way of doing not eating sugar for a week, which and students find it very difficult.
So, Pooja, in your opinion, how can healthcare professionals stay updated with the latest advancement in diabetics care?
Well, one thing that we teach I teach to my nursing students is evidence-based practice. So there are always, always, always protocols and standards that we have to integrate as part of our practice to make sure that we are integrating research,
Hmm.
innovation, um, and good evidence-based practice within our own practices as nurses at the bedside. So I think that's one way to be able to stay up to date with what are the new medications in the market, what's the new technology, right? So even with
Yes,
the CGM that I mentioned, yeah, continuous blood glucose monitoring system, there are at least five different types of different machines out there and methodologies. So just basically staying updated, following standards and procedures and protocols, and integrating that within your practice, staying updated, really. Yeah, including
yes.
research.
That's great. So, Pooja, moving to the last question of the show, how do you navigate the balance between traditional nursing practices and incorporating innovative approaches in diabetes care?
So I think it goes back to wellness care, really. So we integrate the traditional, which is one-to-one personal coaching and creating personalized plans for patients. And in terms of integration, is we're able to check what the patient's fasting blood glucose is with the CGM, what how many highs and lows that they have during the day, how much their blood sugar has been within target. So we're able to modify, see all that, and then modify the traditional, which is the personalized plans, and implement that for the patient, and basically help them that way. So the bringing in the old with the new and combining it together.
And it really it really, it works very well if we combine both the traditional and the modern methods as well. Yeah.
Absolutely, and there's actually that suggests that having both models together, it actually decreases your 3-month average, your A1C, by 2%, which is significant.
Amazing, amazing. That's amazing. Yeah. So yeah, thank you, Pooja, for joining today on our show, and it was a fruitful conversation, and I gained a lot of insights from this conversation. Thank you so much once again for joining and for being a part of Time2Shine community.
Thank you, Roxar. It was a great conversation.
Thank you.